All right, let's look a little bit more about some basic theory. So as I said before, the basic pathologies of blood are blood stasis, blood heat, and blood vacuity. Right, so we have blood stasis, blood heat, and blood vacuity. Take out the blood vacuity and throw it away, because bloodletting doesn't treat that directly. Bloodletting is a draining therapy, treats the repletion patterns of blood, which means we can summarize bloodletting. The primary functions of bloodletting are to basically move stasis, quicken the blood and transform stasis, and clear heat. Most TCM books, and when I was going through and writing my book initially, most TCM books, both in very little in English, but even in Chinese, just give us a long list of everything that bloodletting potentially can do. My opinion, and this is my contribution to the theory, and it's a working model that you can accept, reject, whatever you like. I think it's more useful for us to consider what is the primary function of bloodletting, and understanding that, we can deduce all the other things in the list. So if we know the primary thing that bloodletting does is it basically moves the blood, or moves stasis, right? Because by moving blood, we can also move qi, and clearing heat, then we can understand all the other things that are in the list of bloodletting. The other thing that I'll put in here on this list, and I should probably just move it around a little bit, sort of another primary function of bloodletting, because we're treating the blood and the vessels directly, based on that needle method from the Ling Shu, where it says we needle the blood vessels to treat problems of the blood vessels, and the heart. The simple intervention of treating the blood vessels directly has an effect on the blood and the heart automatically. Get the idea? So then the next slide gives us some of the things that other books describe as functions of bloodletting. So bloodletting stops pain. We use it frequently for pain conditions, especially chronic pain conditions. That's why the Ling Shu said for chronic impediment, we use bloodletting. Why does it move pain? What's pain? Stagnation, right? So we know it can move pain because we're simply moving things. Treating pain is a derivation of the ability to simply move stasis. Resolving toxins, 解毒. So resolving toxins in Chinese medicine are not toxins like you drink something poisonous. Toxin is a specific category of extreme heat that not only creates heat symptoms, but can create significant malaise, can damage tissue. So heat toxins are a more severe type of heat. Why does it treat toxins? Why? Because it clears heat. Right? Next one, swellings and concretions. These are different types of accumulations, masses. Why does it do that? Because it moves stasis. Right? Stops itching. So certain types of itching. So we're not going to, let's say someone has itching from blood vacuity, blood dryness. Maybe not bloodletting is the primary thing we're going to do. But certain types of itching, like itching from heat. Right, so frequently, even in TCM, we were talking about this yesterday. Who was asking me about like acne patients? Yeah, so extreme heat that creates itching, we can also treat like we would treat like facial acne from an excess presentation. Do things like bloodletting on DO14 because it clears heat from the surface of the body and the top of the body, right? And then very effectively treats, like this patient I talked about yesterday, she comes in and she has, I see her like every couple of months, she'll come in because it's flared. Red, literally her whole body is splotchy and red. And I think it's a long-term reaction to the loss of a spouse, right, as a grief reaction. But in her case, it becomes this excess hot, like you can touch her body and it feels, everywhere feels hot, right? And one of the things we do before we do any needling is we bleed this DO14 area because it pulls that heat out of the surface of the body. The bleeding has a Shen calming effect. The bleeding also has a heat clearing effect.
Relate to the demicronization?
So if there is if it's really a heat presentation, then you can use this as a way to clear that heat. So I would also do something like bleeding on DO14. If that rosacea is from, let's say, like an empty heat presentation where the kidney is vacuous underneath, not surprising, right? Then we can do bloodletting, or you can even bleed the ear apex to clear the top of the body. We can do bloodletting then as symptom, that's branch treatment. Then you would have to do some other treatment that consolidates the kidney, perhaps. Get the idea? So bloodletting, just like acupuncture, can be root or branch depending on what the patient is. If the patient's a full excess heat presentation, bloodletting might be root and branch at the same time. If it's bloodletting from a deficiency pattern, or sorry, heat from a deficiency pattern, then you can still do bloodletting. You may not want to do it every single treatment, or you may only want to do it the first 2 or 3 treatments until the symptom's more manageable, and then just consolidate the root after that as root treatment. Got it? Okay. Settles and tranquilizes, opens the orifices. All of this really has to do with bloodletting's ability to treat heart. Okay, so as a 镇静 means has a like a Shen calming effect. Resolves the exterior. Bloodletting can resolve the exterior, really especially in heat presentations, because we're needling very the bloodletting, in my opinion, is safer than conventional acupuncture. So don't be afraid of it. The bleeding technique is a very superficial technique on the body, which is why it can resolve the exterior, especially in heat presentations. Because even though we're bleeding to get blood out, it's also only really at skin depth, right? When we're doing the bloodletting, and when we do the technique, I'll show you, you're holding the needle in a way you're only piercing a couple of millimeters at most into the surface of the body. I'm going to tell you something. You can't create a pneumothorax unless you do it completely wrong. You can't create a pneumothorax doing bloodletting, even over the chest, which may be one of the reasons why Master Dong's lineage, we only bleed the chest, the back. We don't needle it. I mean, if you want to needle, you can. Just know you're not doing Dong's acupuncture. Okay? If you even if you're very careful with a filiform needle, you know, there are cases, I said on the acupuncture board in New Jersey, so we've seen cases like this, where someone is maybe lying on the table, they do back shoe points, the person is kind of thin, and they're fine, but maybe the person moves, they take a really deep breath, and they puncture their own lung with that needle. Because even a half-inch insertion can get lung tissue on some very thin people if they're moving around, taking deep breaths. The bleeding needle you don't leave in, you go, boop, you're done. You're not going to create a pneumothorax, you're not going to pierce a swollen liver, right? You're not going to get peritonitis with a bleeding needle. So in many ways, the bloodletting procedure itself, the needle itself is safer to use on the body than a regular filiform needle. Unless you're doing Toyohari, right? Then you're not going to create pneumothorax. Yeah.
Sorry, I'm seeing a lot of women lately with menopause and hot flashes.
Yes.
And they don't, it's not always predictable, they don't always come to the clinic in the middle of a...
Yeah.
Is it still effective?
So if you see heat in that presentation, right, if you see, like, if you feel the pulse, let's say in the pulse is like the deep and weak in the Chur position, but full in the Sun positions, there's still that heat presentation or the propensity towards heat, yes. If not, then don't bother, just consolidate the root, okay?
Pregnancy.
We'll talk about contraindications and concerns. Yeah, we'll get to that. I don't do it in pregnancy. I'm too risk averse. Honestly, you can bleed the ear apex in pregnancy. It's not a problem.
Yeah, I was thinking about it sometimes.
Yeah, absolutely. Like ear apex, no problem. I wouldn't bleed like the trunk. Yeah. Okay. Everyone happy with the bloodletting functions? So essentially, I'm going to encourage you to consider that bloodletting does a couple of main things, right? Stasis, heat, we can affect blood, vessels, heart, and then the other things that we see in books in terms of functions of bloodletting, these are derivative from the main things that bloodletting does. Okay? Let's talk a little bit about some of the common applications of bloodletting that we see before we delve really much into Dong's bloodletting. Let's talk about some of the common applications we see in bloodletting.